Assalamualaikum warahmatullahi wabarakatuh, and very good morning. Thank you for joining my teaching session again. I'm Dr Rozanizam Zakaria, psychiatrist and lecturer from Kuliah of Medicine, IIM Kuantan. So for those who are new to my channel, so this video is actually meant to be my teaching materials for my undergraduate students who undergo psychiatric hosting for 8 weeks durations. So the video is meant for an introduction to psychiatry, and so that those who have zero ideas where to start in learning about psychiatry, we have some ideas about where to begin, so that they will have some ways of starting their journey in understanding more about psychiatry. So for those who have watched my first video on introduction to psychiatry, I have highlighted a few important points. So namely about why do we need to know about diagnostic criteria, and second is how do we approach psychiatric cases. So I mentioned earlier that there are two main skills that you need. Number one is the skills to understand the DSM-5, and number two is the clerking skills. Okay. Now, with the clerking skills, so the second video, which is this video, I will highlight some important points under clerking. Now, of course, clerking patients in psychiatry is a skills that you need to learn through practical sessions. So you need to learn it by doing it. So unless you see patients, talk to patients, getting to know them, and trying to ask them questions from different perspectives, you will not be able to appreciate the skills of clerking. However, before you do that, you need to have some ideas about what you need to ask and how you need to approach them. So this video is about that. It's about the important things that you need to cover under psychiatry clerking skills. Okay, now, so for psychiatric clerking, I'll be focusing on one important things that you will do in psychiatric clerking, which is history of presenting illness, because that will be the backbone of your clerking. Okay, without good history of presenting illness, you will not be able to get to your main aim. Okay, so remember, when you clerk patients, okay, whatever time that you spend, for example, 10 minutes in short case, or 20 minutes in modified short case, or 1 hour in long case, at the end of your interview, what you need is essentially diagnosis, differential diagnosis, and second one is management. Okay. However, to come to this stage, you need a sufficient amount of information for you to help with the process. So for the time being, let's focus on HOPI, which is the main part of the clerking, which essentially will help you to come up with provisional diagnosis and differential diagnosis. Okay, so what do you need under HOPI? Of course, you start with patient's profile and presenting complaint. Okay, so profiles, whatever information on the background of patients that's important: name, age, marital status, education, occupations, living status. So that's profile. Presenting illness, presenting complaint, normally is something that we gather from asking patient why do they come to the hospital. But do not limit yourself by doing so. Okay, so that's one way of getting presenting complaint. But presenting complaint can also be something that you gather along the way in your HPI. Because you may ask patient, can you tell me why you come to the hospital? They may answer, my father said so, my mother brings me, or I come here for exam, I come here for follow-up. So that doesn't help either. Okay, so you can gather presenting complaint later based on what you get from the history. Second is HOPI, history of presenting illness. So remember, at the end of your HOPI, you need to come up with diagnosis. So to diagnose, what do you need? Okay, so if you've forgotten already, go back to my previous video. We should highlight to you what do you need to diagnose. So you need, number one, symptom. Number two, time frame. Number three, function. Number four, exclusion. Okay, now you need this to diagnose. Without this, you cannot diagnose. If you focus on symptom alone, you cannot diagnose. If you focus on function alone, you cannot diagnose. You need all of this. So therefore, these are the things that you need to integrate in your history taking, in your HOPI. So your component of HOPI should encompass these four main things. Alright? Now, there are many ways of approaching history of presenting illness, but the easiest way, the simplest way, the most effective way is the way that I was taught by my previous lecturer, Dr Rozanizam, which is a timeline method in which you highlight the history based on time frame. Okay, for two reasons. Number one is, of course, you need time frame so that you can diagnose. You need time duration. You need duration and time. Number two, it helps you to organize the symptom chronologically. And because chronological information sometimes is useful, especially if you have overlapping symptoms. If you have mood symptom and then you have psychotic symptom, for example. Okay? Now, chronological order of this symptom is actually very essential in order for you to diagnose. If you remember back this psychosis, mood and anxiety. Okay, when patient have mood symptom and psychotic symptom, your options of diagnosis will fall somewhere along this territory. Okay, so what do you have in there? You have brief psychotic disorder, you have schizophreniform, you have schizophrenia, you have schizoaffective, you have MDD with psychosis, you have psychosis due to substance, psychosis due to medical condition. So roughly you have 6 options of diagnosis. So how do you differentiate one over another? One way is by chronological order of symptoms. For example, if you have somebody presented with mood symptom and somewhere along the problem, patient started to develop psychotic symptom. Now, this resembles what we understand as MDD with psychosis. So let me just help to make it clear for you. So you have mood there, you have psychosis there. So you have MDD with psychosis. Now, what if you have another version? So this is MDD with psychosis. Okay. Now, you have patients with psychotic symptom. Okay, psychotic symptom. Then at some point, patient becomes, let's say, sad, upset, suicidal, for example, here, because the voices is telling them things that are derogatory in nature. For example, you're stupid, you're useless, you should die. Now, this does not represent MDD with psychosis, because in MDD with psychosis, the main symptom must be mood, because that's what the backbone of the diagnosis, mood disorder. So this is still considered as what we call a schizophrenia. Now, what about schizoaffective? Now you have schizoaffective there as well, that present with both mood and psychotic symptoms. Now for Let me put it here. For schizoaffective, you need to go back to the diagnosis of schizoaffective. Okay, so schizoaffective means you have psychotic symptom. In criteria A, schizophrenia, you have concurrent mood symptom. The mood symptoms present in majority duration of illness, but there are periods of at least 2 weeks durations where you have psychosis in the absence of mood symptoms, without mood. Okay, so if you translate that into this chronological order, then you'll find out something like this. So somebody has psychosis, it has mood symptom for majority duration of illness. So psychotic and mood. Hallucination, delusion, irritable, reduced need for sleep, grandiose. So it looks like they have both. But if you look at the time frame, you'll find out that there are period here, let's say 1 month, where patient was predominantly psychotic, no mood symptom whatever, not sad, not manic. Then this whole thing resembles schizoaffective. So you have all three have psychotic and mood, but clear time frame will help you differentiate which is which. Okay, so this is just to illustrate to you why is it important to have a clear time frame, right? So which basically means that whenever you clerk patients, have a clear idea when did this problem start and how it ends with patients being diagnosed. So for example, end up in ED and later admitted to psychiatry ward. So that's the time frame. So when the problem start, for example, August 2020, so ends now, this is November 20. For example, you know when the problem started, you know where your HOPI ends, which is roughly now-ish. Okay, if you clerk patient in ED, for example, or you clerk patient in the ward when they're just being admitted. Alright, so this is basically time frame. Okay, now of course you need to know what happened. So patient will tell you what happened, and that is basically symptom. So you need symptom. You need to locate the symptoms within the time frame. Patient say started to have voices, hallucination, then become paranoid, secretory delusion here, then deteriorate disorganized behavior here, then aggressive here. Okay, cannot sleep starting from here. So this is the symptoms located in the time frame. So you have symptoms. Number 3, you need evidence of function. So insomnia is one way. So maybe other things, WhatsApp care, disturb public, example. So that is 2 already. So interpersonal and self-care, personal. Another one, you need exclusion. So you need, once you've completed the symptoms checklist, you need to exclude. What do you need to exclude? Remember, criteria D, E, and F. Sounds like schizophrenia, so you need to exclude D, E, and F. Okay, so D is either psychiatric problem, E is medical and substance, F is either neurodevelopmental. So this one you exclude in the childhood history. So don't worry about it, but these 2 are the things that you need to ask. Alright, so that is diagnosis. However, in HOPI, apart from these four, there are two more things that you can add on. Okay, right? What are these the other things? Number one is event. Number 6 is progression. What happened since then? Okay, so this should be sufficient to cover in your HLPI. Now, why do we need event? Two reasons. One is certain diagnosis require for you to establish precipitating event. For example, substance-induced psychosis. You cannot diagnose substance-induced psychosis without getting the idea that before all these symptoms develop, patient has taken substance. Psychosis due to another medical condition. For example, patient had meningitis, discharged from the ward, become psychotic. So the event of meningitis phenomenon that patients had is important for you to come up with diagnosis of substance due to another psychosis due to another medical condition. Okay, so events is important. Number two, from event as well, it helps you to reflect on management later on. So for example, a common event is patients stop taking substance, medication, or the event is disturbance in the family, relationship problem, for example. So even though the diagnosis is schizophrenia, but the presence of that event is important for you to establish what are the things that you want to include in your management. Now, what about progression? Progression is important, especially if patient has rather long history. So you need to know what happened since then. Patient has started medication, getting worse, getting bad, getting worse, getting better. So that is also important information to gather in your HPI if you have some spare time. But generally speaking, if you have all of this information, you will be able to have a good HOPI and later have a good options to diagnose patients. Alright? Now, of course, on top of this, there are two more important skills. So this is HOPI skills, I call it. But two more important skills is, number one, is your ability to analyze psychopathology. Okay, so if patient tells you history, experience, but you cannot appreciate what psychopathology is, that you will not be able to differentiate diagnostic criteria either. Alright, so this is one. And number two, more importantly, above all of this, is your history taking skills. Alright, so what are history taking skills? History taking skills is the approach that you have in clerking patients. So your empathy, your style of questionings, the way you approach, use of open-ended and closed-ended appropriately, facilitation, time framing, verification, summarizing. So these are all important history taking. I have one video on introduction to psychiatry clerking for year 4. You can also revise on that if you've forgotten some of these topics. Alright, so that's my video today for you to learn about introduction to psychiatry. So we'll see you again in other topics, inshallah. So hopefully the two main information in the introductory, DSM and clerking, will help you to guide you, to steer you into your journey of understanding more about psychiatry, inshallah. Assalamualaikum warahmatullahi wabarakatuh, and have a very good